Hello friends, I am Dr. Navneet Magu, reconstructive and cosmetic gynecologist, and welcome back to the Healthcare Today. Today I am going to be talking about a very interesting topic to you all, vaginal tightening. We're going to be talking about a tight vagina. This is something which everyone wants to hear about, everyone wants to know about, but most of the times people are too embarrassed to talk about. And let me assure you, as a cosmetic gynecologist, as a healthcare professional, if we are not going to talk about it, then women will have nowhere to go but to the quacks, but to those people who are not expert in this thing scientifically, medically, and they will be cheated. So that is why it is very important that we talk about this very important topic and educate you all about the medical basis of this, the scientific basis of this, and how to have a tight vagina. Now, what happens? Aging, childbirth, and menopause, all of them actually lead to a vagina getting loose over a period of time. जैसे जैसे उम्र बढ़ती है वैसे वैसे वजाइना लूज होती जाती है, and because the vagina keeps getting loose, so the intimacy between a woman and her husband or her partner, that keeps on getting changed in its intensity. होता क्या है कि vaginal laxity जिसको बोलते हैं, and the medical term which is used for it is vaginal laxity. Because of vaginal laxity, neither the woman is able to achieve orgasms or have good sexual intimacy, and nor her male partner feels the same kind of orgasmic pleasure or the sexual pleasure out of their intimate movements. Now, even the WHO, the World Health Organization, says that sexual health is a very important aspect of health. So it is very important that a woman to be able to enjoy her marital bliss and her complete life happily is able to have a good sexual life. And to have a good sexual life, of course there are other components to it, but tight vagina plays a very important role. Now, how does a vagina becomes loose? Is number one, because of childbirth. Let it be a vaginal childbirth or let it be a pregnancy finalizing into a cesarean delivery. Because of the effect of hormones which happen during pregnancy and the childbirth, the vagina starts becoming lax. If there is a vaginal delivery, definitely it makes the vagina totally loose and lax. Number two is aging. As the vagina is used and as the woman ages, her collagen deposits, her elastin, her other muscular tone, that all becomes loose, and again the vagina becomes loose. And finally is the menopause. The moment she starts transiting towards menopause, because of various hormonal and other influences, vagina again becomes loose and lax. Now the medical term which we use for this is vaginal laxity, and vaginal laxity is treatable. It can be treated surgically, it can be treated non-surgically. Now because of lot of things which are not proven, lot of people actually get, I would say, not very satisfactory results when they approach someone for vaginal tightening. Because number one, your doctor may not be trained in proper techniques for vaginal tightening, and their knowledge may be driven from the industry sources or maybe from internet today. That is not adequate. Number two, they may not have the right paraphernalia, the right equipment which helps in tightening a vagina. And again, if they don't have that, so then obviously you will not get your desired results. So that is very important that number one, your doctor to whom you are going for a vaginal tightening must be trained in these procedures adequately, must be trained in reconstructive and cosmetic gynecology, and secondly, they should have the paraphernalia, they should have the right equipment to help you achieve your desired goals and results. So this is something which is very important for you to understand. Now, what is vaginal tightening? It's nothing. As the term says, it is tightening a loose vagina and trying to bring it to that level which you had before childbirth or at the time of your marriage or before your first sexual intercourse. We can try to get your vagina to the same tightness as you had probably at age 16 or 18. How it can be achieved? It can be achieved surgically and it can be achieved non-surgically. Now, the surgical vaginal tightening, which is totally a surgical procedure with great precision, where your surgeon needs to have great dexterity and absolutely fantastic training in different modalities of surgical vaginal tightening, the different components of surgical vaginal tightening, so as to give you the results which you want. It is all about what you want. It is not about what your doctor wants. It's not about what another woman wants. It is exactly about what you want. So therefore, the results have to be individualized to your expectations. So your doctor has to be having a very great level of training in surgical vaginal tightening. And so a surgical vaginal tightening can be done, which is also called as a surgical vaginal rejuvenation. Now, that is one way of achieving vaginal tightening. The other way is the non-surgical vaginal tightening. Now, non-surgical vaginal tightening is in great vogue today, and because of many women trying to avoid surgery, or surgery is a major life event, and I know that you who's listening to me today may also be one among those millions of women who just don't want to get a surgery done for this thing. So you want a non-surgical vaginal tightening. Now, non-surgical vaginal tightening is something which we need to deliberate upon in detail, and in my next video I am going to be talking in detail about the various modalities of non-surgical vaginal tightening. So hey, you keep tuned here in the Healthcare Today. If you want to know how to do a vaginal tightening, how to get a non-surgical vaginal tightening, how to get a surgical vaginal tightening, what to see in your doctor when you're going to approach him or her for a vaginal tightening, and how to achieve your desired results. It is you who matters, no one else. Thank you very much. Keep staying tuned. We care about you.